I'm going to start with two introductions. Firstly, we have the Chattanooga LightForce 40 watt device, which we're going to treat our patient with today. But most importantly, I'd like to introduce you to Natasha. Natasha is a 40-year-old mother of three, and while playing with her children a few weeks ago, she hurt her knee, and she's had it scoped 12 days ago now, and they found that she's got a full thickness chondral deficit of her lateral condyle. So they've taken away a chondral flap and washed out the knee, and Natasha has presented to us 2 days ago with a sort of painful swollen post-op knee. So we've given one session already of LightForce therapy. Now, prior to the therapy, Natasha said at rest you were getting on a visual analog scale 4 out of 10.
4 out of 10, yes.
And then, but if you tried to move your knee, then the pain was going up to 7 out of 10.
Okay.
So after your first session of LightForce therapy, how did it feel?
It felt great. I could relax the leg without any strain and it wasn't painful. And at rest I have no pain, currently no pain. And then when the knee needs to come up or move, the pain is significantly less. Definitely made a difference.
So no pain at rest now, which is great, but you're still getting a bit of pain on movement. Yes. And again, if I was asked you to put that on a visual analog scale, where 0 is no pain and 10 is the worst pain imaginable.
At rest, probably definitely 0, and at when moving, I would say around 4.
Okay,
so
that's great. Okay, so we've had a positive outcome from one session of LightForce, so we're going to continue with that today.
Definitely,
okay?
Thank you.
Good. So, guys, I'm going to put in a few details about our patient here today. I'm going to put in her height, her body type, a skin colour using the Fitzpatrick scale, and the Fitzpatrick scale we can see here, which ranges from 1 to 6, Natasha being a 3 to 4, and she has an acute presentation. I then come on to the body chart. We're dealing with her left knee, and that brings up the pathologies. And here we have post-surgical, so obviously that's what I want to use. And I select, and that now gives me my protocol. Okay, so our final consideration is with this type of therapy, we need to wear protective eyewear. And we've got 2 sets of glasses. We've got one that can go over your spectacles, so you pop those on for me, and I'll wear a normal pair. Okay, there we are, and we look great. Okay, so now we're both protected, we can start the treatment. So I press here. Okay. Now you hear the fan going because there's quite a lot of heat produced from this. And we wait 6 seconds, and now we have a visible light. Okay, this is red light so that we can see where we're working. Okay. Now, when we apply, ideally, we want this 1 centimetre off the skin. The further I am away from the skin, the more the light can diverge and the reduction in the energy density of your skin. So ideally, we want about 1 centimetre. And we have this serrated edge here which takes the probe exactly 1 centimetre away. So providing I'm just off the skin, that's going to be perfect. So to start the treatment, I press here. And the light therapy starts to emit, and we're working, you'll see, in a grid pattern. Okay, I want to work and put energy into all of the cells in the affected area. And then I come across to make sure we haven't missed any. Now what you'll see on this device is a green light. Now this is a traffic light system which the LightForce Therapy includes to ensure that I'm working at the correct speed, which means I'm getting the correct amount of energy into the tissue without creating heat. So you'll see if I start to go too slowly, this is going to go red and tell me to speed up. If I move too quickly, you will see that this turns yellow and tells me to slow down. So Natasha, you're going to feel a warmth in here, but I don't want it to be hot. Okay? So anytime you feel it's getting too hot, just tell me. Good. Perfect. Okay. Now, would you like to show us how far you can bend that knee up now?
Okay. So usually I would start feeling a bit of pain here. This is amazing. It really...
That's amazing, isn't it?
It is amazing.
Okay, so we can see a
Such
significant
short time.
difference.
And it doesn't hurt. It feels stiff, but there's no pain.
Okay.
Nothing.
And the stiffness wasn't helped by the fact you told me yesterday you had to spend the whole day sitting at your
athletics.
athletics tournament with your children. But that's part of being a mother. So.
It's
But that's
really
great. Well done. Okay, so that's our LightForce therapy done, and now we're going to move on to some manual therapy.